Welcome to my presentation for Psychology 308, where I'm focusing on the effects of exercise on mental health, in particular anxiety and depression. I feel I'm quite well versed, having suffered from severe anxiety in my early 20s and using exercise as a tool to cope with this and for treatment. Okay, so first of all, what is anxiety? So anxiety is a disorder that causes nervousness, fear, apprehension, and worrying. It affects how we feel and how we behave, and it also has physiological symptoms such as racing heart, sweaty palms, difficulty breathing, muscle tension, irritability, etc. So for me, I was constantly hyperventilating, so I couldn't get that full breath. And then that led me to have irrational thoughts, including I thought I had lung cancer at one stage because of the way that I was breathing, and so the cycle continued. Okay, so mild anxiety, we all get it. Stress of an upcoming exam or interview can make us feel worried or nervous about what's about to happen. Anxiety becomes an issue when it's out of proportion with what is normally expected in the situation. So it becomes debilitating and can affect our daily life. So work, relationships, health, etc. are all affected. So types of anxiety. Generalized anxiety disorder, panic disorder, phobias, social anxiety, OCD, post-traumatic stress disorder, and separation anxiety. Okay, so depression, what is it? So it's a mood disorder that causes a persistent feeling of sadness and loss of interest. It also affects how you think, feel, and behave, and it can present both emotional and physical problems. So symptoms include feelings of sadness and hopelessness, anger, irritability, loss of interest in things that you once enjoyed, trouble sleeping or wanting too much sleep, lack of energy, changes in appetite, difficulty concentrating, or headaches related to muscle tension. So some of the symptoms of anxiety and depression do overlap. So how can exercise help? Research has shown that exercise has positive effects on mental health, regardless of demographic. So this is quite interesting. Regardless of age, gender, health status, or socioeconomic status, everyone can have positive effects from exercise. So some of the physiological changes experienced during exercise is that it reduces stress hormones, adrenaline and cortisol. It stimulates endorphins and may increase serotonin. So serotonin is a neurotransmitter involved in regulating mood, sleep, appetite, libido, and other functions. So some of the psychological mechanisms of exercise include improved self-efficacy, distraction, and cognitive dissonance. So in regards to increasing self-efficacy, so this can be by mastery of the mind and also the body. So setting yourself goals and achieving these. Okay, so Bach and Morgan found that a single session of exercise was as effective as meditation and quiet rest in reducing anxiety. So it enables individuals to break the cycle of worry and provides a distraction. So this can be a distraction from anxious thoughts and feelings, and for those experiencing anxiety or depression 24/7, this can be a key in highlighting that you can have a break from this worry cycle. Exercise can also lead to an improvement in appearance and body image and an enhancement of self-esteem. So Research has found exercise is as effective as other psychotherapies in reducing depression. So tools for the individual. So what can you do with exercise to help yourself? So pick something you enjoy. This is key. It's key for you to find enjoyment and relief as a form of treatment using exercise. It's key to ensuring that you also stick with the program. So there's no point choosing something that you know that you're not interested in, because you just stop doing it basically. So duration. So research has found that for exercise to be effective in reducing anxiety and depression, it needs to be for at least 20 to 30 minutes and at least 3 to 5 times a week. Now, research has also shown that anaerobic and aerobic exercise both have the ability to reduce the symptoms of anxiety and depression. So recruit a buddy. Find someone who's willing to meet you for a run in the morning, or a sporting team that you can join, or even a fitness class. You'll find it's a lot easier to adhere to your program if you have someone encouraging you along the way. So the final point is to be patient and set small goals. Don't expect to run a marathon straight away. You may not even want to run a marathon, but set small goals. This could be adhering to your program for 1 week or 2 weeks at a time. And also look back and have check-ins to see how far you've come. Good luck.